I've already taken Ms. Bentley's vital signs, height, and weight, and they were all within normal limits. I assessed her gait when she walked in, and it was normal as well. Her skin color is consistent with her genetic background. She's alert and oriented, and her speech is clear. So now I'm about to head on back in and get started. The first thing I'm going to do is I'm going to close the curtain to ensure privacy and wash my hands. Hello, Ms. Bentley. How are you today?
Hello.
Okay, that's good. My name is Quashante, and I'm your nurse, and what we'll be doing today is conducting a head-to-toe assessment. It should take about 30 minutes, so with that being said, let's go ahead and get started. Alright, so I'm going to start with the skin part of the assessment. Do you have any visible tattoos?
No.
Okay, I don't see any. Your skin tone is even. Can you hold out your arms for me? Alright, your skin is warm to touch and equal bilaterally, and your skin is also moist to touch, no dryness. Now I'm just going to pinch up a couple times to check your skin turgor. Alright, so your skin was able to rise easily as well as return to its natural state promptly when released. This shows no signs of edema or dehydration. So now let's go ahead and move to the head part of the assessment. Your head is normal cephalate. Your facial structures are symmetric. I don't see any tics in your facial muscles, and your facial expression is appropriate to your behavior. So now I'm just going to palpate your head. Let me know if you feel any tenderness or pain. Do you feel any pain or tenderness? Okay, so your head is symmetric and smooth. I didn't feel any lumps, lesions, or abrasions. There was no tenderness or palpation, and your hair is healthy and evenly distributed. So now I'm just going to ask you to do a series of tasks here. Can you show your teeth for me? Smile, frown, puff out your cheeks. Hold that for me really quick. Okay, so air escape equally from both cheeks. Raise your eyebrows for me and close your eyes. I'm going to try to open them. Okay, great. Cranial nerve 7 is intact. Now I'm just going to palpate some sinuses here. You should feel pressure but no pain. Do you feel any pain in your frontal?
No.
In your maxillary?
No.
Okay, great. So now if you close your eyes, I'm going to touch you with something, and every time you feel me touch you, say now.
No. 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 No.
Okay, great. Cranial nerve 5 is intact. So now if you can clench your teeth for me. Alright, your mastoid muscle is equally strong on both sides. Continue to clench your teeth while I try to pull down on your chin. Okay, great. Cranial nerve 5 is intact. Last but not least, I'm going to check your TMJ here. Can you open and close your mouth for me? Did you feel any pain? Okay, great. There was no indication of popping or crepitation. So with that being said, let's go ahead and move on to the eye part of the exam. Okay, so earlier in the exam, I've already assessed Bria's visual acuity. According to the Snellen chart, her vision was a 20/30. And as I explained to her, what she could see 20 feet away is what the normal eye could see 30 feet away. Alright, so I don't see any lumps, lesions, or abrasions on your eyes. Can you look up for me? Alright, your conjunctiva are pink and more sclerochina white. Can you look down for me? I'm just trying to see if I see any redness or swelling. I don't. Okay, let me check and see if I see any excessive tearing in your lacrimal ducts. And I don't. So everything looks pretty good there. So now what I'm going to do, I'm going to do a couple of tests here. So if you can just hop down really quick. I am going to do a confrontation test here. You take a card and you cover whichever eye you want to cover. I'm going to match this eye here. And whenever you see my hand, I want you to say now for me, okay?
No. No. No.
Okay, great. Now we're going to do the other eye here.
No. No. No.
Okay, great. That lets me know that cranial nerve 2 is intact, and cranial nerve 2 is intact as well with her Snellen chart. So now the next test we're going to do here, we're going to just check some light accommodation and reaction. So if you can just stare past me, I'm going to put my pen in your line of focus, and when you see my pen, focus in on that for me. Okay, so your eyes is focusing on the pen, which is what I was looking for. If you continue to look past me, I'm just going to shine my light in each eye to check to see if your pupils can constrict. Okay. Okay, great. So I did see symmetrical contraction there. That lets me know that cranial nerves 2 and 3 are intact. So now what I'm going to do is a corneal light reflex test here. So if you could just stare directly at my nose, I'm going to shine my light in both eyes. Okay, and the light did reflect off the same position in each cornea, which is what I was looking for. So if you could continue to stare at my nose, I am going to do a cover test here. And I'm going to cover your eye. I'm checking for any deviation. Just remain looking at me. Alright, great. So your eyes did have a steady gaze. Your gaze was steady and fixed, which is what I was looking for. And last but not least, if you could continue to stare straight at me and refrain from moving your head, only your eyes when you see my finger move. I'm doing a 6-point diagnostic test. Okay, great. So I did see parallel movement right there, and so that lets me know that cranial nerve 6, 4, and 3 are intact. So really quick, I'm gonna go ahead and do an internal eye exam. You can just scoot over just a little bit for me. Okay. Okay. Coming in at a 15-degree angle here in your right eye. All right, so your red reflex is present, your optic disc is creamy yellow, and your retinal arteries and veins are visible impaired. Okay, looks pretty good there. Now I'm just going to swing around and do your left eye here. Coming at a 15-degree angle. All right, your red reflex is present, optic disc is creamy yellow, retinal arteries visible impaired. I'm sorry. All right, so everything looks good with the eye part of the exam. Now we can go ahead and move to the mouth and nose part. I'm just going to put on my gloves here really quick. Your lips seem symmetric. I don't see any cracks, abrasions, or lesions, and they do not appear to be dry. So can you open your mouth for me? All right, great. So your buccal mucosa are pink and moist. I'm able to see your Stinson's duct. Your hard and soft palate are pink and moist. Your posterior pharynx and pillars are pink and moist. Your tonsils are present, 2+. Uvula is midline. Can you stick your tongue out for me? All right, so your tongue is pink and moist. Can you put your tongue to the roof of your mouth? All right, so your tongue and frenulum are midline. I'm able to see your Wharton's duct. The ventral surface of your tongue is smooth, glistening, and I see veins and saliva present. You seem to have good oral hygiene. I don't see any dental caries. Your wisdom teeth are absent. Can you say off for me? Okay, soft uvula and palate rose at the same time. Now I'm going to check your gag reflex here. With your soft uvula and when your soft palate and uvula rose at the same time, that lets me know cranial nerve 10 is intact. Now I'm going to check your gag reflex. Oh. Got it?
Yeah.
Let me do it again.
Okay.
All right, cranial nerve 9 is intact. Can you say light, tight, dynamite?
Light, tight, dynamite.
All right, great. That lets me know cranial nerve 12 is intact. Can you close your eyes for me? I'm going to do a quick taste test here. If you can stick the tip of your tongue out and let me know what you taste here. Salt. Okay, great. Cranial nerve 7 is intact. So that completes the mouth part of the exam. Just now I'm going to go ahead and move to the nose part of the exam. Okay, your nose is midline to your face. I don't feel any lumps, and I don't see any lesions or abrasions, which is great. So now I'm going to do a smell test here. If you can close your eyes, I'm going to close off one nostril here. And when I ask you to sniff, I want you to identify what you smell, okay?
Alcohol.
Sorry?
Alcohol.
Okay, great. Cranial nerve 1 is intact. So really quick, I'm going to do a internal nose exam here. You can hold your head back for me. Alright, so your nasal mucosa are red, smooth, and moist. I don't see any swelling, bleeding, or discharge, and your nasal septum is not deviated. So everything looks pretty good there. Alright, so now I can go ahead and move to the ear part of the exam. So your ears are symmetric, and now I'm just going to touch them, and you let me know if you feel any pain in your auricle, mastoid process, traded. Okay, great. So everything looks pretty good there. Now I'm going to do a hearing test. So if you close off whichever ear you would like, I'm just going to whisper something in your ear, and I would like for you to say out loud what I whisper to you.
A, B, C.
Okay.
1, 2, 3.
Okay, great. Cranial nerve 8 is intact. So now I have another test I'm going to do. It's called the Weber's test here, and I'm going to stimulate my tuning fork and place it on top of your head. Let me know when you can't hear that anymore.
I can't hear.
Okay, great. Cranial nerve 8 is intact. Now I'm going to do a Rennes test, and what I'm going to do, I'm going to stimulate my tuning fork, and I'm going to place it on your mastoid process. Let me know when you can hear it and can't hear it. Then when you can't hear it, I'm going to move it to the front of your ear canal, and I want you to let me know when you can hear it and you can't hear it. Then we're going to do it for your opposite ear. Grab my watch here.
Can't hear. Can't hear.
Okay, great.
I can hear it. You know, I can't hear it.
Okay.
I can hear it.
Okay.
And now I can't hear it.
Okay, great. So that lets me know that cranial nerve 8 is intact there, and that your air conduction was longer than your bone conductions, which is really great. So now if you could just scoot over a little bit, I'm going to do a quick internal ear exam here. Okay. going to start with your right ear here, and from the external ear canal on your right ear, I don't see any excess dryness. So now I'm about to go ahead and go on in, pulling the pin up and back. All right, so your tympanic membrane is pearly gray, shiny and translucent. I do see the cone light at a 7 o'clock. I'm sorry, at a 5 o'clock position, and there's no bulging or retraction noted, so everything looks pretty good there. So let me change my perfume. Alright, so I'm gonna move over here to your left ear, and I don't see any excess drainage coming from your left external ear canal, so now I'm about to go in. I'm gonna pull the pin up and back. Alright, so I do see your tympanic membrane. It is pearly gray, translucent and shiny. The cone light is at a 7 o'clock position, and no bulging or retraction of it. So everything looks good there. Okay, so now what we're going to do, we're going to go ahead and move to the nose. I'm sorry, not the nose, the neck part of the exam. I'm just now going to touch some lymph nodes. You let me know if you feel any pain throughout this, okay? Okay. Preauricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Did you feel any pain there? Yeah. Okay, so all of those lymph nodes was tender, non-tender, discrete, soft, and movable, which is what I was looking for. So I'm gonna go ahead and test some neck and muscle strength here. If you can resist, can you shrug your shoulders against my resistance of trying to push down? Okay. All right, turn your head for me. All right, great, and turn your head again for me. All right, great. So that lets me know that cranial nerve 11 is that intact. Can you hold your head back for me? I'm gonna check your trachea. Okay, your trachea is midline. So now I'm just gonna move behind you really quick, and I am going to check your thyroid here. If you can sit up straight, lean forward, and tilt your head to the right. All right, can you swallow for me? All right, great. Do you feel any pain? No. All right, now can you tilt it again for me to the opposite side? Swallow for me. Do you feel any pain? No. Okay, great. So I didn't feel any lumps or masses there, which is really, really good. So now I'm just gonna palpate your carotid arteries. I'm also gonna listen to them, okay? Okay, great. So your left and right carotid arteries have a greater than 2+, which is what I was looking for. So now I'm just going to listen to them really quick and just check and see if I hear any bruits. Okay, great. So I didn't hear any bruits there, which is what I was looking for. So now that I am done with the neck, I'm just going to go ahead and move to the chest part of the exam. So your thorax is symmetrical and elliptical in shape with downward sloping ribs 45 degrees relative to the spine, and your skin color is consistent with your genetic background, and you seem to have a good relaxed posture, which is what I was looking for. So now I'm just going to listen to some heart sounds here. Change the bell to the diaphragm. All right, so I'm gonna start off listening to your aortic valve here on your right sternal border, second intercostal space. All right, that sounds really good. Now I'm gonna move over to your pulmonic valve, which is on the left sternal border, second intercostal space. Okay, that sounds really good. Now I'm just gonna go up under your shirt, and I'm gonna listen to the tricuspid valve, which is on the lower left sternal border, fifth intercostal space. Okay, and then your mitral valve, which is on the mid-clavicular line, fifth intercostal space. Okay, so everything sounded really good there. I was able to hear the S1 and S2 heartbeat throughout. I didn't hear any murmurs. S1 is best heard at the apex of the heart, S2 best heard at the base. So now what I'm going to do, I'm just going to go ahead and listen to some breath sounds anteriorly, and then I'm going to move to your back. So the first one I'm going to listen to is your bronchial breath sounds. Every time you feel my stethoscope touch you, just take a deep breath for me. Okay, those bronchial breath sounds in your neck were high in pitch and loud in amplitude, which is what I was looking for. So now I'm just going to go ahead and move on to your bronchovesicular breath sounds along your sternal border here. Okay, those were moderate in pitch and amplitude, which is what I was looking for. Now I'm going to go under your shirt here and listen to some vesicular breath sounds. Okay, so those were low in pitch and soft in amplitude, which is what I was looking for. I didn't hear any adventition sounds anteriorly. Now I'm just going to move on to the back to listen to your bronchovesicular sounds, which is between your scapula and next to your spine. Okay, those were moderate in pitch and amplitude as well. So now I'm just going to listen to some vesicular breath sounds here underneath your shirt along your scapula. Okay, great. Those were low in pitch and soft in amplitude, which is really great. I didn't hear any adventitious breath sounds there either. So now what I'm going to do, I'm going to do a couple of tests while I'm back here. The first test I'm going to do is the respiratory excursion test. If you could take a deep breath for me. All right, so your back expanded about 3 centimeters, which is good because the normal range is from 3 to 5 centimeters. So now I'm just going to do a tactile fremetis test here. Every time you feel me touch, you say 99.
99, 99, 99. 99.
Okay, great. I did feel vibrations throughout, so now I'm just gonna percuss while I'm back here. Just bear along with me. Okay, great. So I did hear resonance throughout, which is what I was looking for there. So now I'm just going to come on back to the front of you here. I'm going to check your pulses and capillary refill. So let me just check something really quick. All right, so that was under 2 seconds, which is what I was looking for. So now I'm going to just check your pulses here. I'm going to first start off with your radial pulses. Okay, those are have a gradient of 2+ and equal bilaterally. I'm now going to move on up to your brachial pulses. Okay, those have a gradient of 2+, and those are equal bilaterally as well. So if you could kick your shoes off really quick for me. And you can just go ahead and lie back because we're going to go ahead and move on to the abdomen part of the exam. But while I'm down here, I'm just going to check your posterior tibial pulse here. This has a gradient of 2+, and they are equal bilaterally as well. So now I'm going to check your dorsalis pedis pulse. And those have a gradient of 2+ and equal bilaterally as well. So all of that is really good there. So now let's move on to the abdomen part of the exam. I'm just going to lift your shirt a little bit. All right, so your abdomen is flat and it is symmetric bilaterally. Your umbilicus is midline and inverted. Your skin tone is smooth and even, and I don't see any obvious lesions, abrasions, or scars, which looks really good here. So now I'm just going to listen to all 4 quadrants to see if I hear some vowel sounds. Okay, starting with your right lower quadrant. Okay, your right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, great. I was able to hear some vowel sounds, which is what I was looking for. So now I'm just going to listen to some abdominal arteries here with the bell of my stethoscope. I'm going to start off with your aorta. Okay, right renal artery. Left renal artery. Right iliac. And your left iliac. Okay, I didn't hear any waves or bruises, which was what I was looking for. So now I'm just going to percuss in each quadrant here. Just bear along with me. I'm going to start right here in your right lower quadrant. Right upper. Left upper. And left lower. Okay, so tympani was present and dullness was heard in the appropriate areas, which is what I was looking for. So now I'm just going to do some palpations here. I'm going to go light and then I'm going to go deep. Anytime you feel any pain at all, just let me know. I'm going to start here in your right lower quadrant with my light palpations. Right upper. Left upper. And left lower. Okay, great. Did you feel any pain there? All right, I I didn't feel any lumps and masses. Now I'm just going to go a little bit deeper here. Starting with my right lower quadrant. Right upper. Left upper. Left lower. Okay, so did you feel any pain? All right, great. I didn't feel any lumps and masses there. So I think I am done with your stomach here. If you can go ahead and sit up for me and turn around. I'm just going to come to the back of you. I'm going to do a costovertebral angle tenderness test. You're probably like, what is that? I'm just checking your kidneys back here, okay?
Okay.
You should feel a thud, but no pain. Okay, did you feel any pain? Okay, great. So everything looks good there with the abdomen part of the exam. Now we're going to go ahead and get you to stand up, and we're going to do some range of motion exercises here. All right. Uh-oh, my bad. Let me move that out of the way. If you could stand on this side. Okay. All right. So can you put your chin to chest for flexion for me, and head to back for extension. Look at me for right rotation. Look at the curtain for left rotation. And then we're going to put the right ear to the right shoulder for right lateral bending, left ear to left shoulder for left lateral bending. All right, did you feel any pain? All right, there was no indication of papa or crepitation. I'm going to scoot you over just a little bit. So we're going to go ahead and do this right elbow here. Can you hold it up for me for flexion? Put it back down for extension. Palm to the ground for pronation, palm up for supination. Did you feel any pain? All right, no popping, no indication of popping or crepitation. So now we're going to go ahead and move to the wrist here. Can you put your hand towards your body for honor deviation, away from your body for radial deviation, lift your hand up for flexion, down for extension. Did you feel any pain? There was no indication of popping or crepitation. I'm going to just go ahead and do your spine while I'm here. Okay. If you could bend towards me for right lateral bending, and then to the left for left lateral bending. Bend down to touch your toes for flexion. Okay, come back up for me. Lean back for extension. Great. And then you're going to twist towards me for right rotation and twist towards the curtain for left rotation. Did you feel any pain? All right, there was no indication of popping or crepitation. I'm just going to go ahead and move to your knee here. Okay. You might want to try to lean up your knee too. Oh, okay. All right, so can you get ready to kick the ball for flexion and kick the ball for extension? All right, great. Did you feel any pain? No. There was no indication of popping or crepitation. All right, so with your ankle here, can you put your big toe towards your body for inversion, away from your body for eversion? Press on the gas for plantar flexion and lift it up for dorsiflexion. Did you feel any pain? There was no indication of popping or crepitation. Now we're going to do this knee over here on the left side. If you can get ready to kick the ball for flexion and kick it for extension. All right, great. So now I'm going to do your ankle here. Put your big toe towards your body for inversion, away for eversion. Press down on the glass for plantar flexion and release for dorsiflexion. Did you feel any pain? All right, great. So last but not least, we're going to go ahead and do your left elbow here. If you can lift your arm up for flexion, down for extension, palm facing the ground for pronation, palm up for supination. Did you feel any pain? No. No, there was no indication of popping or crepitation. For your wrist here, can we put it towards our body for honor deviation, away for radial deviation, up for flexion, down for extension? Did you feel any pain? No. All right, great. So there was no indication of popping or crepitation. Everything looks pretty good there. So I'm just going to stand over here, and I would like for you to walk to me in a straight line in a heel to toe fashion, please. Okay, let's take a couple steps back. Okay, so I just did a tandem walking test there, and everything looks good. Your coordination is really good. So if you can come step up for me and put your hand on by your side and close your eyes. All right, so I just did a rhomboid test. You have a negative grading of that, which is good because you don't have any excess swaying. You just have the normal swaying that comes with that test. So everything looks pretty good there. If you can just go ahead and hop back on up there for me. I'll let me move my stethoscope out of the way. You're fine. All right, so now I'm just going to test some upper and lower extremities here. If you can hold your hands like this and try to resist me pulling against you and pushing against you. Now I'm going to do your legs, pulling and pushing. Okay, great. So you have equal muscle strength in your upper and lower extremities, which is what I was looking for. So now we're going to do a rapid alternating movement test here. I want you to touch your fingers to your thumbs and then just reverse and speed up, please. Okay, great. So that shows me that you have good coordination there. That's good. So now we're going to do a sensory test. If you can close your eyes, I'm going to place something in your hand. I want you to identify what that is, okay?
Okay.
Yes, okay. So now what I'm going to do here, I am going to ask you to hold your hand out again, close your eyes, and I'm going to write something in. I want you to identify is really good. So with those two tests, you was able to identify the object and the number presented, which is great. Lets you know everything is good with your sensory there. So what I'm going to quickly do is a deep tendon reflex test here. So I am going to do your, if you could flip around for me, let me do it right here. Okay. So if you can go real limp for me, okay? I'm going hips to check your tricep. Let me do it again. Okay, great. Everything looks pretty good there. Now we're going to do your biceps here. All right, great. Everything looks really good there. All right, if you can uncross your legs for me, I'm going to hit your patellar. All right, so everything looks pretty good there. And now I'm going to do your Achilles reflex here. Okay, great. So all your reflex has a grading of 2 pluses, which is what I was looking for. So I'm going to take a quick minute to look at my chart to make sure I hit everything I needed. Okay, well, it looks like I hit everything on this exam here. So, Miss Bria, if you have any questions, just let me know, and I hope you have a nice day.
You too.